Hello, everyone. This is Dr. Jessica Freedman. I'm happy to be here tonight. I'm just going to wait for people to trickle in and make sure that we're all set in terms of our technology. Just going over to our Facebook page so I can take a look at the questions that everybody has posted today. And I will start off by answering those questions. For those of you who are not members of our Facebook group, you can join our Facebook group. We have a pretty active membership. And, so I encourage you, if you are not a member, to join. Okay, let me go ahead and let me go to the Facebook group so I can pull up our questions. Okay, so let me just introduce myself for those of you who potentially have not been to any of our lives before and who don't know me. My name is Dr. Jessica Freedman. I am an emergency physician. I am a former medical school and residency admissions officer at the Icahn School of Medicine at Mount Sinai. I have spent my entire career working in medical admissions. And I founded Med Edits. I think I always have to count, but I think about 16 years ago. And while I learned a ton while I was working at Mount Sinai in admissions, I've learned even more since I've been working with all of our students who span, the country, really who span the world when it comes to residency admissions in particular, who go to all different types of undergraduate colleges, are from all over the country, and who have many different paths to medical school. So that has really given me and has given my entire team an incredible depth and breadth of experience and knowledge. And this is part of the reason why we are so effective in helping our students. And another thing is we really observe the trends in medical admissions. So things do change, and we are very cognizant of those changes. So we always sort of have our finger on the pulse, so to speak, with regards to what medical school admissions committees want to say. And that does change. And we've certainly seen that change in particular, I'd say over the past 3 to 4 years. So this is why if you do want to work with us, we certainly can offer a benefit. But in the meantime, we also have a lot of free services that can help people who are interested in medicine, who are pre-med, who are applying to medical school, who are applying to residency. And these lives are one of those ways. And then the Facebook group, which is free, you can join our Facebook group. You can post questions. And if you tag me, I'm happy to answer those questions. So you have access to me there. So I'm just going to head on over to the Facebook group and I'm going to answer the questions that are posted there. So Yas asks, can you please comment on the Hofstra BSMD program, please? So BSMD programs, what you need to consider, generally speaking, when you are looking at BSMD programs is you need to look at the undergraduate college that is affiliated with BSMD program. And then in particular, you need to look at the medical school that is affiliated with the BSMD program. So I can tell you that Hofstra as an undergraduate college and certainly as a medical school, both outstanding institutions. Hofstra, honestly, is one of my favorite medical schools. I think it's a great medical school with tremendous leadership, a wonderful curriculum. Many of our students have gone to Hofstra, and we are big fans of Hofstra Medical School. So, certainly I think that's a great BSMD program. Okay. Anisha asks, can you comment on shadowing? Is it different than clinical experience? So shadowing is very different than clinical experience. Both are valued in the medical school admissions process. Shadowing is just what it sounds like. You are shadowing a physician. You are observing them work. It's a passive activity. Sometimes if you are lucky, you might shadow a physician who is really eager about teaching and who might, kind of really, take you under their wing and teach you things, give you assigned reading, maybe even ask you questions and treat you more like a medical student or a resident. But oftentimes we find that shadowing can be a little bit boring. It can get get pretty boring pretty quickly, especially for students who are, real doers and who really want to have hands-on experience. And that is the biggest differentiator between shadowing and true clinical experience. True clinical experience is when you are actually touching a patient and you are actually getting your hands dirty. You are being involved in patient care. You're being involved in teamwork. You are working with the other members of the healthcare team. You're understanding, how things operate in the setting where you're practicing, whether that is a nursing home, whether that's a hospital, whether that's an office. And so those are the biggest differentiators between shadowing and true clinical experience. True clinical experience is hands-on experience. And if you have any questions, please write them wherever you are into the comments or the chat, and I will answer them. Okay. Shazi asks, my sophomore received a C+ for organic chemistry. Should she retake or leave it as it is? So organic chemistry has always been a classic Weeder class, and it's tough. So getting 1 C+ in a prerequisite, probably this was sophomore year of college, it happens. It's not a complete deal breaker by any means. We look at grade trends, medical school admissions committees look at grade trends, and usually a student who, let's say, has a slow start freshman year, very, very common, or has a C+ or, hopefully higher, not lower than a C+ in a prerequisite class, is going to have an upward trend as they progress in their undergraduate education. So my recommendation would not be to retake the class. When you retake a class, it is expected you are going to get an A. And on the medical school application, you're going to have to include both of those grades unless your college has some other, sort of rules where does that grade replace the previous grade that you're retaking. But I can tell you most colleges, sort of very selective colleges do not do that. In most cases, both of those grades are going to appear on your transcript. And so then when you are entering your grades into the medical school application, you're going to include both of those grades. It's going to be factored into your overall GPA, and it's going to be assumed that, of course, you should do well in the repeat when you retake organic. What if you don't do so well when you repeat the course? Then it's an even bigger red flag. So rather than retaking a class when you maybe haven't done so well, instead we recommend taking upper level classes, demonstrating your excellence, your academic excellence, your proficiency in upper level classes. And that sort of negates then the C+ that maybe you got when you take an upper level class that's, more sophisticated even than organic chemistry. And medical school admissions committees know what are the classic Weeder classes. So that is not a deal breaker in and of itself by any stretch. Okay. Rahana asks, if a child received multiple acceptances, some from top 10 medical schools, but the child is set on a particular school at which he got deferred decision until March, should he mention in his letter of interest that he has other acceptances, but he really loves the school? So yes, Rashana, I think it's a great thing. First of all, congratulations on all of those acceptances. That's phenomenal and very unusual in this process. And certainly the student should be writing something along the lines of, despite having multiple acceptances from other top medical schools for which I am truly grateful, your school remains my top choice. And if accepted, I will attend, assuming that that is true. So we most certainly, when we have students who have multiple acceptances, but they haven't yet gotten that acceptance from the school that is their number one choice, we definitely have them communicate that information in their letter of intent to that top choice school. Okay. Ravi asks, is volunteering at a hospital preferred over summer internship at a company? Okay, so Ravi asks, is volunteering at a hospital preferred over a summer internship at a company, somewhere between sophomore and junior years? We would really need to know more about this. Usually, volunteering at a hospital is not something that medical school applicants, especially if they are undergraduates, are doing on a full-time basis. Usually, hospital volunteering is something that they are doing alongside something else. In terms of doing an internship at a company, we would need to know more about what that internship is, because if it's, let's say, a finance company or something like more along the business, in the business world, we might not recommend that. So we would need to see what that experience was, and we would need to kind of weigh in on if that was a good option. But the hospital volunteering really should be done alongside whatever the primary summer activity is, would be probably be my recommendation. Okay. Rada asks, is research needed for med school admissions? If a student doesn't have research, how about acceptance to med school? So in terms of is research required or not, technically it is not a requirement. This largely depends on what the student's goals are. If the student is aiming to go to an osteopathic medical school, then I do not feel that research is absolutely necessary. If they are aiming for, let's say, an MD granting school, an allopathic school that is more community focused or rural focused, it's possible that research isn't absolutely necessary. I can tell you that most of the successful medical school applicants that we work with who are aspiring to go to allopathic, meaning MD granting medical school, the overwhelming majority have research experience. However, it isn't as if they have thousands and thousands of hours of research experience. The people who have the most research experience, those are usually students who are applying to the most competitive medical schools in the country and medical schools that are very research focused. You can look at the MSAR, which is the medical school admissions requirements, to see what percentage of students at every allopathic MD granting school in the country, what percentage of their matriculants had certain types of experience, one of those experiences being research. If you want to delve in further and really look at the data, you can find it there. Good questions that everyone posted. Okay, Oceana asks, could you expand on the path from community college to medical school? Would you be able to share some success stories based on the path? What kind of extracurriculars do you recommend in general for optimizing chances of acceptance to medical school besides specific personal ones? So certainly medical schools accept community college credits. So there are some students who are going to start off their undergraduate careers at community colleges and are going to then go on to four-year undergraduate colleges. The primary sort of buckets of experiences that students should have when they're applying to medical school, number one, they need clinical exposure, preferably hands-on clinical experience. Not everybody has hands-on clinical experience and they are successful. We want you to have some type of community service, ideally working with populations who are different than you, working in communities that are maybe different than the ones that you grew up in or grew up with. So sort of developing that cultural competence, understanding inequities that exist not only in healthcare, but in our country. Teaching is also something that many successful medical school applicants have, whether that's working as a TA at your own college or perhaps doing some tutoring or something of that nature. But certainly I would say research, clinical experience, clinical exposure, and community service, and then teaching. Those are sort of the four big categories. And of course, then there are many, many other things as well. And there are some students who also just have unique paths to medical school. And so they may have other really outstanding experiences that are kind of outside the realm of those four major categories. Okay, Jolene asks, can you explain your program at MedEdits? Who will my child work with? How does the program work? I don't like to use these lives to talk about the services here at MedEdits. If you are interested in working with us, I encourage you to sign up for a free 15-minute consultation, or you can send us an email, info@mededits.com, and we'll go ahead and we'll send you a link to that free 15-minute consultation, and we'd be happy to talk to you to explain how we work with students, talk about where your student is in the process, and how we can assist them. Okay, Kimberly asks, my first year college daughter has two possible opportunities for work study internship, working as a lab tech in a gastric research lab or working as a patient coordinator in the radiology department of a hospital. Which would be viewed as more valuable for med school? So Kimberly, again, it depends on what your daughter wants, what her ultimate goals are, and what her other opportunities are. Honestly, these both sound like fantastic experiences, especially for someone who is a freshman who's in their first year of college. So they probably are just starting on their path, to medical school, and they're probably just starting on their pre-medical path. So I would say that she should choose the experience that, number one, is going to be the most interesting for her. And number two, I would choose the one where she's going to be given the most responsibility. So it's possible, for example, that perhaps being a lab tech in a gastro research lab, she might just be, doing something that is very routine, very ordinary, isn't going to really be involved in the research. It's possible that perhaps working as a patient coordinator in the radiology department, maybe she's going to actually be given more responsibility in that role. I don't know. I'm just guessing. So I would say really find out what are going to be her roles and responsibilities in those two positions, and then choose the one that sounds the most interesting to her and the one where she's going to be given the most independence and the most responsibility. Okay, this is a great question. Is it common to send a letter of intent before all decisions come out? So no, it is not common to send a letter of intent before all decisions come out. Sometimes we recommend this if it's a little bit later in the admission cycle, and let's say the student doesn't yet have any acceptances. But at this stage of the admission cycle, if a student has interviewed, that could come off as a little bit desperate, and we don't want you to come off as desperate. So probably, and also it might, because then it sort of implies the student doesn't have any other interviews, isn't expecting any other interviews. So at this stage, I would say you shouldn't send a letter of intent before a decision is released. The only way that I would recommend this is if this is for a medical school when all of the decisions are being released in bulk in March. And so you really want to make it clear to that medical school, if I get into your medical school, I'm coming. So that might be the only time when I would suggest that it's okay to send a letter of intent before the decision is released, but I probably would still wait until February to do so. Okay. If you have checked all the boxes, what experience will make you stand out as a re-applicant? We try not to sort of identify the experience that's going to make you stand out, because it isn't one particular experience itself that makes you stand out in this process. What makes you stand out in this process is when you can demonstrate through your experiences that you are an expert at something, that you have a niche, that you have really thrown yourself into something, whether that is oncology research, whether that's clinical care in a specific department. So something where you have really developed an expertise, you've really shown a commitment, and you really have a niche. Those are the students who tend to do the best in this process. And also the students who sort of have a spike in something. So that spike can be in research, again, a particular discipline of research. Maybe they've even worked in 2 different labs or 2 different settings where they've been researching, the same field. Or maybe they have extensive clinical experience where they've been working as a scribe or as a medical assistant or as a phlebotomist. They've been doing something for, over several years. Many students do this alongside their undergraduate studies. So the students who stand out the most are the ones that really have demonstrated interest in something in particular where they've devoted a lot of time to the experience and they're really committed to it. Okay, this is okay. As you view the minimums, how many hours of clinical research, community service, volunteering, teaching, scribe are needed? It's impossible to say. Most students don't have extensive experience in all of these categories. So I would say most students have a spike in one or two categories. What that spike is depends on several things. It depends on how old they are. Are they applying as juniors at the end of junior year of college? Are they applying after 2 gap years of college? Are they applying at the end of senior year of college? So we have to look at all of this in terms of making these recommendations within the context of the applicant. You've heard of holistic admissions. We very much practice holistic review, which is why I can't give you a definitive answer to this, because it really depends on the applicant and it depends on what the applicant's expertise is, where their other strengths are, what their challenges have been, how old they are. I realized I didn't plug in my microphone, so let me do that right now. I'm so sorry. Okay, I hope you all can hear me better now. I apologize for that. So we don't, make recommendations in terms of the specific number of hours because there are just so many variables that go into this when we're advising students, that we really need to take a very holistic approach when we're making those recommendations. My son has received multiple acceptances at mid-tier schools. How does he decide between schools? Would it be appropriate for my son to let the schools know that financial aid will be an important factor in his decision-making process? First of all, any U.S. allopathic medical school is an outstanding school. There is no such thing, in my opinion, as a mid-tier school because a student can get to any residency specialty and any residency they want from any U.S. based allopathic medical school in this country. So that's the first thing. In terms of financial aid, absolutely, he should be communicating with the financial aid offices, with the medical schools, and trying to get the best aid possible and using any offers he has to kind of, make those schools compete for him. Absolutely. Then beyond that, he obviously needs to look at geography. He needs to look at curriculum. He needs to look at residency placement. So when we are trying to help a student decide where they should go to medical school, if they have choices, we're really focusing on the residency placement for that medical school. And we will often make decisions based on that, depending on what the student's goals are. It's all within the context of that. And then medical schools will have accepted students days in April. And so once he's narrowed it down, he tries to attend as many accepted student days as possible. Now that the vast majority of medical school interviews are virtual, I think it's very, very difficult to get the real vibe of a school virtually. I think you have to be there in person. You have to meet the students. You have to see the institution. You have to see the hospital. You have to get a sense of where the school is located to really make an informed decision. So if you have the luxury of choice, once you've narrowed it down, you try to go to as many of those revisit days for the schools that you're really seriously considering. Okay. How will retaking a course look for the MD admissions committee? What if there were extenuating factors that impacted the first grade? So Oceana, I think I addressed this question already. Maybe you didn't hear, but we generally do not recommend retaking a class. Instead, we recommend taking an upper level class to show excellence in that discipline, but at the upper level. When students retake a class, both of those grades are going to be seen, and it is going to be assumed that the student should do better on the retake. So we generally do not recommend retaking a class. Is it more important to have scribe work or to do research during a gap year? And how important is it to publish your research? So in terms of research versus scribing during a gap year, It depends on what the student's interests are, depends on what the student's goals are. It depends on where their experience, what experience they already have. Do they have experience they can build on and really sort of turn that into, kind of an expertise for them? Do they have any clinical experience at all? What are their goals? Are they going for a very research heavy school? Are they going for sort of more of a school that puts more emphasis on clinical work? So these are all things that we're looking at when we're helping students to decide how they should be spending their gap year time. It is not necessarily important to publish your research. Medical school admissions committee members know that publishing research, there's so many variables that are going to impact your success in that process. Publications take a long, long time. Often it takes a tremendous amount of luck to get published. So publications, while they are a great feather to have and a wonderful gold star, they are not absolutely necessary in this process. What's more important are what were your contributions in the lab? What were your contributions to the research you did? How is your letter of recommendation from that principal investigator or whoever the immediate, supervisor you had was? That's what's going to become more important than the publication itself. And also remember that whatever you are doing during the year that you're actually applying to medical school, that still counts. And so if, let's say, you are involved in research and you're in your second year of research and you're applying during that year and you find out that you have a paper that's finally being submitted and you have enough data to be able to submit that paper and have a realistic shot at it getting published, you can communicate that to your medical schools. So the admissions process is a fluid process, and we're always updating our schools to keep them abreast of what's going on. Is taking a gap year looked favorably by admissions committees if you spend time pursuing certain activities compared to not taking a gap year? We find that many students have a tough time doing everything that they need to do in 3 years to be ready to apply to medical school. So if you're not taking a gap year, that means you're applying at the end of your junior year, and we want you to be competitive. Most students, it's a lot, and they also want to have a social life during college. They want to have some free time. And, so fitting in all your coursework, doing all your courses, taking your MCAT, getting in all your experiences. For many, many students, that simply just isn't something that they want to do in 3 years. They'd rather take a gap year. They'd rather give themselves a little more time to be able to achieve everything that they need to be able to achieve to become a competitive applicant. We certainly work with students who apply at the end of junior year, who do not take gap years. They are exceptional students. They still have outstanding experiences, and they have everything that they need to be competitive. So I wouldn't say that med schools necessarily prefer or they don't prefer a gap year. I can tell you that the majority of successful applicants now are taking gap years, but that's not because the med schools prefer them. That's because most of the students who are taking gap years are the more competitive applicants, because they are able to gain more experience and they're able to still do well in their academics and on their MCAT. So it's that those tend to be the more competitive applicants. So this is always a conversation that we have with students when we first start working with them. Do we feel that they are competitive enough to be able to apply at the end of junior year? Do we feel that they really need that gap year in order to be competitive, to be able to apply? What are their goals? And that's sort of how we make that determination if a gap year is actually needed and if it's something that we recommend. Is it harder to get in as a reapplicant to the schools where you got waitlisted? This is a tough question. Again, depends on the applicant. We have students who certainly have come to us at the end of an application cycle. I didn't get into any of my medical schools at all. I got waitlisted. I got interviewed at one. I didn't get into any. They reapply. They get accepted. So you certainly can get into schools where you are a reapplicant. You can get into schools where you have been previously waitlisted. I wouldn't say it's necessarily harder, because those medical schools, you have new people reviewing your application. It's being looked at fresh. So, being a reapplicant is not held against people. So there's really no stigma to that. So I wouldn't say it's harder. I'd say it's just as hard. Getting into med school is hard. It's just as hard as a reapplicant. But I don't think that waitlisted applicants who are reapplying are in a more difficult position. Additionally, we've started to worry because my son hasn't received any rejections and has only received an interview invitation from one school. Should we be concerned and consider reapplying? Around now is around the time when we start looking at students who don't have multiple interviews. If they have a lot of pending schools, we try to strategize. Is it worth communicating with those schools? How are you going to communicate with those schools? What are you going to say? What updates do you have? With the one school where you interviewed, when do you expect to hear back from that medical school? Should we be thinking about a letter of intent? And when should we be thinking about a letter of intent? So we look at the application, we try to identify any weaknesses. We try to, really push for those schools that are still in play, meaning the schools where you haven't yet heard anything from, as well as the school where you've interviewed. And we really try to make the most of those opportunities. If you haven't been rejected, it's still a potential opportunity. I can tell you every year we have students who receive all of their interviews after the new year, and they do matriculate in that year. So all is not lost, but we certainly are getting to the point where we want to be looking at an application if a student doesn't yet have an acceptance in, let's say, January, February. Okay, please check your post from today for questions. Okay, let me go over it. Maybe you posted something. I answered a bunch of these questions already. So it's very possible if you're just tuning in now that I already answered these questions, but I'm going to go ahead and I'm going to look. Okay, so Tracy asked about which LECOM location do you feel provides better clinical opportunities with neighboring hospitals, et cetera. I would honestly have to look, Tracy, at the LECOM clinical rotations and hospitals. I'd have to look at that in more detail. I don't know the answer to that off the top of my head. And I think that I've answered otherwise all the questions that are posted. So if you're tuning in late for any reason, you can watch the recording. And I think I answered all the questions that were posted already. Okay. Are there any other questions at all? It's about 8:30 or so or 9:30 our time. I hope everybody had a very, very Merry Christmas if you celebrate. And I hope everyone has a terrific new year. If anyone is applying this year, please download our application toolkit, which will sort of keep you on track for your application year, give you some tips, make sure that you're all set to apply. Otherwise, we will see you next week in 2024. I cannot even believe it. I hope you all have a wonderful new year. Stay safe. I'll see you in 2024. Thank you so much for being here. Have a great weekend.